6 vitamins prevent heart attacks and strokes. According to the Centers for Disease Control and Prevention, one person dies every 34 seconds from cardiovascular disease, which is the leading cause of death in the United States. According to the CDC, around 697,000 persons in the United States die from heart disease in 2020. That equates to almost 1 out of every 5 deaths reported that year. However, you do have some power over preventing cardiovascular disease. A balanced diet can help you reduce your risk of heart disease. Diets that cut extra calories, saturated fat, trans fat, salt, and dietary cholesterol, such as the Mediterranean diet, are recommended by the American Heart Association. If you aren't obtaining enough vitamins and minerals from your regular diet, the AHA recommends taking supplements, but keep in mind that dietary supplements are simply that, supplements. Supplements cannot substitute a healthy diet, so consider a balanced diet before walking down the supplement aisle. With that said, here are the 5 best vitamins to prevent heart attacks and strokes. 1. Fiber. According to the Mayo Clinic, eating a fiber-rich diet may help decrease your blood cholesterol levels. According to the clinic, research has indicated that high-fiber diets may help lower blood pressure and inflammation, both of which can benefit heart health. The clinic also advises that patients who do not consume enough fiber, particularly soluble fiber, might benefit from fiber supplements such as Metamucil, Consul, and Citracel. While there is no evidence that using fiber supplements daily is harmful, they can cause certain adverse effects like bloating and gas. The Mayo Clinic also advises that if you have a history of Crohn's disease or a blocked bowel, you should see your doctor before using fiber supplements. 2. Omega-3s. Omega-3 fatty acids have been demonstrated in studies to help reduce heart disease and stroke. According to the National Center for Complementary and Integrative Health, those who consume a diet high in seafood, a good source of omega-3 fats, are less likely to die from heart disease. These studies compared those who ate seafood at least once a week to those who ate it very rarely or never at all. Omega-3 fat supplements, such as fish oil or cod liver oil, are available for purchase. Several investigations on these supplements, however, failed to uncover compelling evidence that they significantly decreased heart disease. The best approach to get omega-3 fatty acids is to eat them naturally. Fatty fish to look for include wild salmon, sardines, mussels, rainbow trout, and Atlantic mackerel. If you are using blood-clotting medication, you should check with your doctor before taking any omega-3 supplements. Because high-dose supplementation increases the risk of atrial fibrillation, it is always a good idea to see your doctor before starting a fish oil supplement. Recommended intake. For those with heart disease, the American Heart Association, AHA, recommends ingesting roughly 1 gram, 1,000 milligrams of EPA and DHA per day, ideally through the consumption of oily fish. Supplements may be a possibility under the supervision of a doctor. For the general population, the American Heart Association suggests consuming 1 to 2 servings, 4 to 8 ounces, of seafood each week to minimize the risk of several heart issues, particularly if taken in replacement of less healthful food. The American Heart Association does not advocate omega-3 supplements for persons who are not at high risk of cardiovascular disease. First, increase your seafood consumption. If you don't consume seafood and wish to take a supplement, see your doctor. They may do a blood test to determine your omega-3 serum index and adjust your suggested dose appropriately. 3. Coenzyme Q10. Coenzyme Q10 is a natural antioxidant produced by your body. However, as you become older, your levels of coenzyme Q10 decrease. According to the Mayo Clinic, patients with heart disease have reduced amounts of coenzyme Q10. Foods that contain coenzyme Q10 include salmon, tuna, trout, and mackerel, which are examples of oily fish. Some plant-based meals include soybeans, lentils, peanuts, pistachios, and canola oil. However, you may boost your levels of this antioxidant using dietary supplements. According to the Mayo Clinic, coenzyme Q10 supplements are available in capsules, chewable tablets, liquid, and powder form. As the Mayo Clinic says, coenzyme Q10 has been demonstrated to enhance conditions that lessen the risk of congestive heart failure. It may also aid in blood pressure control. When mixed with other nutrients, it may even benefit those who have had heart valve and bypass surgery. According to the Mayo Clinic, coenzyme Q10 supplements have rare and typically moderate side effects, such as lack of appetite, nausea, diarrhea, and upper abdominal discomfort. If you are on Coumadin, warfarin, avoid taking coenzyme Q10. Recommended intake. If you're concerned about your coenzyme Q10 levels, you may get a blood test done at your doctor's office. Even if they're on a statin, most people may maintain their coenzyme Q10 levels regularly by eating a nutritious diet. If coenzyme Q10 levels remain low after modifying the diet, supplementation may be necessary. Coenzyme Q10 supplements may be labeled as ubiquinone or ubiquinol. Ubiquinol is more easily absorbed than ubiquinone. It should be taken with a fat-containing meal to maximize absorption. Because there is no defined suggested dose for coenzyme Q10, consult with your doctor to determine whether and how much coenzyme Q10 supplementation is appropriate for you. 4. Magnesium. Heart palpitations may occur if you don't get enough magnesium. This is because magnesium helps your body maintain a regular pulse and reduce blood pressure. According to the Cleveland Clinic, a deficiency of this mineral can also produce fatigue, loss of appetite, muscular spasms, nausea, and an overall sense of weakness. Eat whole grains and dark green leafy vegetables to naturally enhance your magnesium levels. Magnesium may also be obtained from low-fat milk, yogurt, soybeans, baked beans, peanuts, almonds, and cashews. You can also get your magnesium via supplements, but eating magnesium-rich foods is preferable according to medical professionals. If you have end-stage liver or renal disease, you should be extremely cautious about eating too much magnesium, especially through dietary supplements, because too much of this mineral can be harmful. Excess magnesium in meals is quite unusual. It is more likely due to oversupplementation. 5. Folic acid. Folic acid, commonly known as vitamin B9, can help maintain a healthy amount of homocysteine in your blood when combined with vitamins B6 and B12. This is important. High levels of homocysteine, an amino acid, are linked to an increased risk of heart disease. Folic acid supplementation does not reduce the risk of heart disease but does assist in protecting against heart diseases such as stroke. The CDC also recommends that women who may get pregnant take 400 micrograms of folic acid every day. This is because this B vitamin aids in the prevention of birth defects. According to the Mayo Clinic, a diet high in dark green leafy vegetables, peas, beans, and almonds is the best source of folic acid. Fruits high in folic acid include lemons, oranges, melons, bananas, and strawberries. Folic acid is also available in synthetic form in vitamins and meals fortified with the vitamin, such as cereals and pasta. Folic acid supplements are recommended by the Mayo Clinic for patients who have poor diets or disorders that interfere with their body's capacity to absorb folate. Mild side effects of folic acid supplements include nausea, lack of appetite, confusion, and irritability. You may also observe sleep disruptions after using folic acid pills. 6. Vitamin D. Low vitamin D levels raise the risk of heart attack, stroke, and hypertension. Supplementing with vitamin D has been shown to lower blood pressure, but only in people who have both high blood pressure and a vitamin D deficit. People with high blood pressure but normal vitamin D levels do not benefit from vitamin D. If you are already taking any drugs, see your doctor before taking vitamin D supplements. Vitamin D raises calcium levels in the body, which could interfere with some cardiac drugs that similarly boost calcium levels. Digoxin, diltiazem, verapamil, and hydrochlorothiazide are examples. Food sources of vitamin D include fatty fish, salmon, herring, and sardine, fortified foods, cereals, orange juice, dairy alternatives, egg yolks, and mushrooms. Recommended intake. Humans get most of their vitamin D from a chemical process that occurs when our skin is exposed to sunlight. Clouds, smog, aging, and having dark-colored skin, on the other hand, lower the quantity of vitamin D your skin produces. Vitamin D deficiency is a common condition caused mostly by poor sunshine exposure. If you are concerned that your vitamin D levels are low, get a simple blood test from your doctor. Well, there you have it. 6 vitamins prevent heart attacks and strokes. Hope the video helped. Thanks for watching.